Hi, my name is Mr. Faris. I am a consultant gynecologist working at the Lister Hospital in Chelsea in London. 1 in 3 women develop fibroids at some point in their life. Some fibroids are considered insignificant. Fibroids are more common with women with Afro-Caribbean origin. They are non-cancerous growths. They develop in and around the uterus. They're made of muscles and fibrous tissues. They vary in size. The size and rate of growth can be affected by the hormones such as estrogen. They tend to shrink after menopause. The exact cause of development of fibroid remains unknown, but some propose that the cause can have genetic tendency. It can run in families. It can also be caused by changes in growth factors, which are proteins involved in the rate and extent of growth of cells and tissues within the womb. It can also be related to abnormalities in the vascular pattern and the vessels in the womb. Fibroids can grow anywhere in the womb and vary in size and places where it grows. It can vary between a pea size and a melon size. The most common ones develop in the muscle of the womb inside the wall of the womb. Those that develop in the muscular layer of the womb are called intramural fibroids. Some of them develop in the muscle and push themselves into the cavity of the womb. Some of them are totally inside the cavity and they're called intracavitary submucosal fibroid. Some develop outside of the womb beneath the membrane covering the outer surface of the uterus, which are called subserosal fibroids. Some fibroids have a stalk that are just attached to the uterus and they're called pedunculated fibroids. A lot of women are unaware of the presence of fibroid in the womb. This can just be diagnosed during a routine ultrasound scan. However, symptoms of fibroid could be heavy periods, painful period, bleeding between periods. Women can simply present with anemia, low iron levels, tummy ache, low back pain, sense of fullness and pressure symptoms, which on the bladder can create frequency and sense of urgency to pass urine. Pressure on the bowels can create constipation and bowel symptoms. Discomfort during intercourse can also be one of the symptoms related to fibroid. Fibroid can be associated with fertility problem when woman is trying to conceive. Investigations for fibroid including a simple ultrasound scan which can diagnose a fibroid, a 3-dimensional scan, contrast scan where we put fluid inside the uterus to assess how the fibroid is indenting into the cavity of the uterus, or offering MRI as an alternative.
And I started using it, then I was placed, my challenge was fibroid. But the kind of fibroid I have, if you see me, you will say nothing there, because it's inside the womb, not even outside. So the tummy is not coming out as if I have any issue. So I was placed on some supplements, and I started buying monthly buying. Then the first thing I noticed is that one day I was in the toilet in my place of work. I just hear something like nylon, something just came out. I was like, what is this in my body? I was like, what? And this month precisely, that was the first week of this month. So I traveled. So I met another person that was telling me there's a solution to fibroid issue. So, and I was asked to go and do a scan. So I went to run another scan. And to my surprise, you know, I was having three fibroids. So the scan results now shows that 2 has already disappeared. I was like, how come? You know, this God is great. Then the scan now reflected that the last one, very big, like a 16 weeks old pregnancy. So it was the only one that remained. And I began to pray, God, I don't know how these two left me. So this remaining one, just perform your wonders. As I'm standing with you, the last one came out right as I left. Everything to the glory of God. And that's why I said forever I'm grateful to God. I'm grateful to friends that introduced this product to me because it has been 7 years battle.